At Stonewater, our patients live on campus. It is a campus that we've designed to feel very residential. We did that purposefully because we realized that oftentimes treatment can feel very clinical, and so we went to great lengths at Stonewater to preserve a very home-like feel. So at Stonewater, we feel that it's important to get our patients off campus so that they're not always inside of the home. So we do a number of things in the community, from 12-step meetings to volunteerism efforts where the patients are going to different, typically nonprofits, to help volunteer their time and effort to really get a feel for what it means to give back, and the feel good that we receive from doing that. It's good for them to see how that in itself can help support their recovery. When we have adolescents living with one another and doing life with one another, it's different, and we would argue more therapeutic than if we had an adult and an adolescent doing life together and trying to sort of manage that relationship and the difference in age. I think too, with our adolescents being close to the same age, it allows for them to connect with one another upon leaving treatment, so that they're establishing these lifelong bonds and relationship that can help promote their recovery upon leaving Stonewater. We do alumni events that invite our graduates back into our program and onto our campus to enjoy certain aspects of what we do, and I think that with them being all in adolescence together, it really allows them to get excited about that time and coming back into the program and seeing one another and spending time with one another. Our academic programs are as individualized as our treatment programs. We have the capacity at Stonewater to work either with teachers and schools locally that the patients have transitioned from, and are able to bring those curriculums in-house and allow the patient to continue to move forward in that given curriculum, assuming that the school or the teacher or administration is open to that. We're also able to enroll the patients in online curriculums through a number of different platforms that offer nationally accredited programs and allow the patient to attain nationally accepted school credits that can then be transitioned back into their school district that they transition to after leaving Stonewater. So what's really encouraging about that is that our patients can come to Stonewater behind in school and then find themselves leaving Stonewater ahead in school because of how much ground they're able to make up while they're in this program. In addition to the high school or middle school curriculums that would allow a patient to gain credits toward graduating from a high school, we also offer SAT and ACT programs where the patient can study towards passing one of those tests successfully. We have GED and HiSET programs that would allow the patient to pursue a degree that is a high school education equivalent. So there's a number of options through our academic program that allow us to really work with our families to decide what is best for that individual patient and meeting that individual's needs.